More than 200 delegates from all over the UK, and somewhere among them, someone who later discovered they have the coronavirus infection. Government Minister Baroness Veer opened the summit on bus transport at this central London conference centre, metres from Parliament Square and Westminster Abbey. The event continued all day on Thursday last week.
Yesterday, the delegates who were here received a letter saying while the degree of contact that they may have had with the case is unlikely to be significant, as a precaution, they should still stay indoors and avoid contact with others.
Two MPs who attended, Alex Sobel and Lillian Greenwood, have now cancelled their engagements for the next 5 days. It's now a fortnight since two people at a hotel in York became the UK's first confirmed cases of COVID-19. Less than a week later, a man in Brighton who'd caught the virus in Singapore was diagnosed. 5 people connected to that man then tested positive. The 9th case emerged in London, a woman who had recently arrived from China. She took a taxi to Lewisham Hospital's A&E, and 2 staff have been isolated as a result. But public health officials say there's not a risk to other patients.
You have to have had close face-to-face contact or to have been within 2 metres of an individual for 15 minutes or more to meet the criteria that mean you need to isolate. So just somebody walking into A&E or walking around anywhere isn't enough to spread the disease as we understand it.
One unanticipated knock-on effect.
Open wide.
Dentists are warning of a shortage of the face masks they wear for every consultation.
We use 1 mask per patient.
This practice needs 90 masks a day, but their usual supplier is out of stock, and an alternative is charging them twice the price.
There's a shortage from our suppliers who get it from China, and as their supply dries up, they've had to ration us. If we don't have any face masks, it's not really very safe to be working. So the chances are we'd have to turn patients away. And as you can imagine, if you've got toothache, it's not something you want to delay having looked at. So it does have huge ramifications.
In all kinds of ways, the spread of coronavirus is continuing to make an impact right across the United Kingdom.
And Catherine joins me now. So, Catherine, are we going to see any other kind of shortages similar to what we're seeing with the masks?
Well, £200 million worth of pharmaceutical products come from China to the UK every year. And a lot of that is going to be basic stuff, like gloves that you see in hospitals, like surgical masks. There are going to be delays for obvious reasons. And quite understandably, actually, China's want to try to keep hold of some of that stuff that they also desperately need at the moment. More broadly, 2 things to look at that people are already worried about. The car industry. Wuhan, the centre of the outbreak, is very much the centre for car parts and accessories manufacturing. Secondly, China's the biggest exporter of electronic and electrical goods, and that's a large part of the world economy. People are already worrying that it'll be a global manufacturing recession until at least the middle of the next year because of that.
OK, Catherine, more on this, and thanks very much.